The member for Bowman has the call.
Deputy Speaker, thank you for this opportunity on this incredibly important area of tuberculosis in our region. And I think Australians, people living in the Torres Strait, and even citizens of Papua New Guinea itself would be getting tired of these banal government reports about AusAid's efforts in Papua New Guinea doing well, could do better, and allow us a little more time. Because time is the one thing that TB patients don't have. And it was a year and a half ago, that this Prime Minister wrote to then Premier Anna Bligh in response to a request for more financial assistance with the troubles that were created in TI by the movement of TB-infected PNG citizens across that 2-kilometre stretch of water. The response from the Prime Minister was simple. There is no more money. And I need to make a very clear point to the previous two speakers on this issue of tuberculosis with PNG nationals. The impact of foreign nationals on the Australian health system is the responsibility of the federal government. And since 1978, we've had a Torres Strait agreement with the Queensland government to compensate that state for the costs of PNG nationals. And it's something that every government until this one has proudly compensated Queensland for. And as the costs of TB began to escalate, and let's remember the previous Premier Anna Bligh sought more funding, it was not forthcoming. Now, no one is asking this federal government to solve the issue of tuberculosis in our region. No, that's not what we're talking about. What we are talking about here is asking AusAid at the drop of a hat within 3 months to initiate a tuberculosis program in a part of the world where they have no experience. Search the website for AusAid, you will see not a single TB program in Papua New Guinea prior to this request. Our only criticism from this side of the chamber is you should have left more time for the good work that was being done in Torres Strait to continue until Papua New Guinea picked up its capacity and could stand on its own 2 feet. So I don't care how many WHO reports there are talking about the great work that AusAid has done in a limited period of time. This is a disease that is highly contagious through spit, through speaking, through coughing, through sneezing, through close proximity with other infected people, particularly areas where people have low resistance, low autoimmunity, even concomitant HIV. These people are at great risk, and they are only 2 kilometres away from Australia. So the surveillance issue has not been raised today, but the presence of qualified physicians in Saibai and Boigu is almost unable to be priced. It's wonderful and important, but it is now gone. And to bring those clinics back, it is a responsibility of the federal government. Look, it hasn't been talked about in this place before, Deputy Speaker, but November last year, a young 9-year-old Papua New Guinea girl presented for care at Boigu. Not once, not twice, but 5 times. The 4th time she had a distended abdomen, on the 5th time she had cerebral TB, and on each of those times she was told to go away. Go away for no other reason than a federal government had decided there was no more funding for TB in Torres Strait. That young girl was evacuated too late to save her life, and she died in Cairns. And it is the subject, I would hope, of a coronial inquiry. But this was the problem with dropping TI without setting up Papua New Guinea first. We don't ask for Papua New Guinea to solve the problem. We don't expect AusAid to cure the world. We just wanted concomitant care in TI to look after people like that young 9-year-old girl. Well, where is the XDR, the multi-drug resistant tuberculosis, right now? There's 6 cases of them. No one's talked about them. 5 are in Daru Hospital, and 1 of them is in Cairns Hospital right now. And one of those cases in Daru is the nurse that was looking after the other XDR patients. There were not enough masks, worn not often enough, and the care provider now has multi-drug resistant TB. So don't for a moment think that Papua New Guinea can just pick up the ball and run. There is limited capacity to diagnose this disease, to work out what are the appropriate treatments. If people are resistant to rifampicin and isoniazid and to one of the quinolone families, then you're left with just amikacin or capreomycin or kanamycin. Now, doing that in Daru is hard. Doing it in Mabaduan is close on impossible. I have enormous respect for the people working at AusAid and those they employ, but you cannot expect this to be fixed in months. This is a year-long transition. But it was this government, Deputy Speaker, that couldn't find the extra nickel and dime to continue those clinics that has cursed the people of Daru and Western Province to be utterly reliant on an infantile TB program that will not be up and running for years. And that is the great tragedy that will not be forgotten by clinicians in Cairns, by the nurses who go and visit Daru, by the nurses who go and visit the TI and do the very best they can with those who cross the Torres Strait.
Order.